Thank you for joining us this afternoon. My name is Ryan Semke. For those of you who don't know me, I'm with Move United. You're tuning into Safety Differently, applying lessons learned from occupational safety industries to outdoor programs. Before turning it over to our speaker, Steve Smith, I'd like to go over a few housekeeping items. This session will be recorded and posted to the Move United Leadership Conference webpage. For those of you who are interested in reviewing the session, sharing it with your communities, that's where you'll be able to find it, along with a copy of the slides in the presentation. For those who need closed captioning, directions to enable closed captioning will be provided shortly in the chat. All attendees will be on mute to help minimize distractions, but please use the chat feature. While using the chat feature, please make sure that you're sending it to all panelists and attendees, not just the panelists. That way you're engaging with everyone in attendance. Also, we encourage you to use the question feature on the toolbar on the right side of your screen to submit questions. We'll be holding a Q&A session at the end, so please get your questions in through the Q&A feature so we're able to address them. And without any further ado, I will turn it over to Steve.
Well, thank you so much, Ryan, and thanks to the folks at Move United for putting together this talk and asking me to come give this talk. It's wonderful to see such a nice turnout of folks. You know, obviously, before I dive into this presentation, I just want to acknowledge our country's been going through a difficult time, and I'm really thrilled that you all are taking the time to come spend with me on this today and maybe learn some new concepts that could help us move through some of the challenges that we've been having. And I'm going to present some stuff here that might challenge some of our pre-existing ideas and paradigms around risk management and safety, and hopefully have a very interactive session as well, where you're going to not just sit back and watch and listen to this webinar, but have a chance to participate and offer some of your own applications of these concepts too. So really just pleased to be here, and thank you all for making time to spend with me. Looking forward to your thoughts on this material. So my name is Steve Smith, and this talk is called Safety Differently. And let me get to a place where I can advance through the slides. Here we go. I'll tell you a little bit more about myself and my background. I'm a risk management consultant based out of Seattle. I run a company called Experiential Consulting LLC, and we mostly work with outdoor, and as the title implies, experiential education programs, conservation corps, wilderness therapy, schools, nonprofits, for-profits. We work with different organizations on their risk management and safety systems. I've been working in the outdoor industry for 30 years. I've held risk management and leadership roles at programs like Outward Bound and the Student Conservation Association. A couple other little nuggets. I taught at Washington State University, and I also have a background in human resources. So all these things give me a pretty wide range of lenses to look at the work that I do with organizations. I'm a regular speaker at national conferences, and for those of you who have been to the Wilderness Risk Management Conference, I had the honor of chairing that conference for 3 years. So that's just a little bit about my background and the perspective that I bring to this work. And my pronouns are he and him. So I'll give you an overview of what we're going to do here today, a couple of the objectives. We're going to make a really crisp distinction between traditional safety management over the years and current thinking, a new way of looking at risk management and safety, which we call safety differently. We're going to be looking at research and examples from many different occupational safety industries, medicine, construction, aeronautical, et cetera, firefighting, and drawing lessons from those different industries that we can apply to our own organizations. We're going to use research and case studies. And really, the reason to do all this is not to look at how do we do this in these different industries, but to give you a chance to apply some of these concepts to your own programs. So let's dive in right off the bat with a case study. So this one comes to us from the healthcare profession. And there was, in this fairly large study, there were 25,000 healthcare professionals that were involved. And what they found is that 1 out of 13 patients in this healthcare system were being harmed in the process of receiving care. So some kind of complication or a new injury or a new infection that came about separate from the issue that they were in the hospital to begin with to treat. So this is what's known as a nosocomial complication, which means one that is caused by the healthcare system itself. So they thought that this was a problem, and they asked for a risk management expert and author, Sydney Decker, who we're going to talk more about later in this presentation, to come help them understand what was happening in this case. So they looked at this 1 out of 13. They looked at those cases, and what they found was a list of problems, workarounds, shortcuts, violations, guidelines not being followed, human errors and miscalculations, people or equipment that was not where it was supposed to be, unreliable measurements, new technology that was not user-friendly. Hard to imagine, but that's what they found. Organizational frustrations in the workplace and shortcomings with the supervision of the staff themselves. Okay, so these were the things that they were seeing and that they assessed were contributing factors to these 1 out of 13 patients coming in and having some kind of a complication. So what do you think? This is where you get to this. We'll get interactive here right off the bat, if possible. What do you think is going wrong here? I'm going to give you a minute or so to think about that. If you look at this list of contributing factors, what do you think is going wrong? What would you do if you were in charge of this healthcare system? If you were the supervisor of one of these hospitals, what would you do? So I'm going to give you a moment to think about that and invite you, if you wish, to pop some of your thoughts into the chat box, either about what you think is going wrong or what would you do to fix it. Let's see some ideas. So Chris suggests taking a closer look at the policies. Kristen suggests some staffing issues, training inconsistencies. Any other suggestions? Tiffany has some thoughts on communication. Empowering staff by Casey. Great. Okay. Incomplete understanding of processes and policies. Great. Okay, thank you all so much. That's very helpful. So we're gonna, rather than diving more deeply into this case study, we're gonna present some things and then come back to this case study and see where that takes us. Maggie suggests that there could be issues with fatigue, training, and possibly helped by instituting checklists. Great, thanks for that. So we're going to come back to this case study in a little bit after we look at some other concepts. Let's pause here, and I'll ask Ryan to launch a poll that he's created just to give me and you a sense of what kinds of organizations we have represented on the call right now. So if you would please take a moment and just tell us what kind of organization you are representing today. So we've got a very high representation from adaptive sports organizations, VA medical centers, and then a scattering of universities, outdoor recreation, parks and rec. Thanks so much for doing that. That gives us a good sense of who's on the webinar today. So I want to dive more deeply into this concept of safety one, or traditional safety, and let's explore that. So traditional safety is a mindset and a methodology that we're all actually pretty familiar with. And I think that a lot of what I'm about to talk about here will really seem familiar to you, although it may not have been packaged up and presented to you in this format. So let's take a closer look at that. So in this framework of traditional safety, it really comes from the top down, from the boss or from whoever designed the rules and the regulations in the organization that you're working at. In this view, unfortunately, we recognize that in many cases, the way that our policies and procedures and training and workplace is set up sees the workers themselves as a problem to be managed. And I'll just give you some examples of that. As a result, the focus is often on improving the behavior, improving worker behavior, either before or after some kind of incident occurs. This mindset sees safety as the absence of accidents and injuries, the absence of these things. We focus on tracking what has gone wrong, what injuries and illnesses and issues and accidents have occurred. And many times, the way that it's set up and articulated is a quest for zero incidents. You know, you will frequently see safety as our first priority and things like that, and that we're on a quest for zero incidents. So let's start digging into these and looking at them one at a time. So that idea of zero is a really interesting one. And I've worked with and I've worked for some organizations that had an explicit written risk management goal of zero incidents. And ironically and counterintuitively, studies and research show that if you set an explicit goal of zero incidents, that actually increases the likelihood of a fatality occurring on your program. So let's look at one study of many that show this. This is a study of the construction industry, construction companies over a 4-year period, 20 different companies over a 4-year period. This was a study that's fairly recent, 2017. And we're gonna look at 2 categories. We're gonna look at companies that had this explicit goal of zero and companies that did not have a goal of zero. And we're gonna take a look at their incidents, their injuries and their fatalities. So for companies that had the goal of zero, they had 214 major injuries as opposed to only 135 for companies that did not have that goal. How about fatalities? This is the highest metric we could look at, right? Companies that had the goal of zero incidents had 4 fatalities and the others had none. My question to you is, how in the world could this be? This is one study of many that show this kind of a trend. It's very counterintuitive. It doesn't really ring true with us. I'd love for you to ponder on this for a moment. How could this possibly be that the company that explicitly focuses its goal as zero ends up with more than the companies that don't do that? If you have thoughts or ideas on that, please feel free to, again, pop them into the chat box. Oh, there's a suggestion by Rebecca that they could be overcompensating. It's an interesting theory. Like riding a bike, if you're so focused on avoiding something, you're more likely to hit it. That's a really good observation by Kirsten. Let's dig into this a little bit more. This is something that is, could the fear of creating an incident actually create incidents? These are really good insights from folks. Thanks for engaging with that. I find it to be a really curious and puzzling question. So let's dig into the zero paradox a little bit and see what's going on with that. So the studies show that the effects of setting this explicit goal of zero incidents is it suppresses incident reporting and learning. If your explicit goal, we tolerate no incidents at this organization, who wants to be the one to raise their hand and say, well, I actually got hurt on the job, or even a near miss occurred and I don't want to look bad to my supervisor, so I'm gonna just keep that to myself. They found this, the study we looked at was from the construction industry, but they've also found with airlines that the ones who have the best track record as far as reported injuries are more likely to not wreck than the ones who have this spotless safety record and then have plane crashes. So again, it comes down to suppressing that culture of incident reporting and learning. And that can lead to optics compliance, really trying to manipulate the numbers to make sure that things look good. I'll tell you a story about this. There was, in one of these construction settings, there was someone, they had one of these signs, you know, at the construction site, 357 days since our last accident. I'm just making that number up, but you know, one of these signs that kind of has a running ticker of how many days we've been accident free. And someone actually got hurt that day at work, and they went to the doctor. And while they were at the doctor getting seen, they got a call from the school where their kid went to school, that their kid was sick and needed to be picked up. So they called back into the construction site to the office and explained that after the doctor's appointment, they weren't going to be able to come back to work because they needed to go pick up their kid. And there was much celebration there in the front office, because now, instead of treating this as an injury, a lost time from work kind of injury, they could just treat it as a personal matter where the person had to go pick up their kid. And so it's optics compliance. They were able to switch the sign the next day and say 358 days since our last injury. It's this quest to look good rather than to actually be good and to be honest about what's really happening. So that's an example of optics compliance, manipulating the numbers to look good. It can also create this resignation. You know, if you tell people that our goal is 0 every year, people know that's just not true. It's inauthentic, and it can create this learned helplessness on the part of the actual workers. That can create this us versus them feel between the management and the workers themselves. So that's a really just short list of some of the reasons why that 0 paradox exists. Let's look at this next one, which is this one is subtitled the real problem. What's the real problem? And in this mindset, people are the problem. If we could only get rid of the bad apples, if we could only populate our organizations with the right people, we wouldn't be having some of these issues. In this mindset, whether it's explicit like this or not, there's a belief, that we can eliminate human error through controls such as rules and training and enforcing those rules and training. I'm going to give you an example from the US Forest Service. They, in their accident investigation guide from 2003, which has fortunately been updated since then, by the way, but at the time they had this line this is at the very beginning of the 100-page long accident investigation guide. And what it stated was that the cause of most workplace accidents or incidents are a result of the failure to observe established policies, procedures, and controls. So one more time, this is the front page, the very first page of the accident investigation guide, and it's giving you the answer. It's telling you that the cause of the accident was someone's failure to follow the rules. So the obvious question for me would be, why are we going to do this investigation if we already know what the answer is, which is that someone broke the rules and someone is to blame for this? So again, in this safety one or traditional safety mindset, it really comes from the top down to the employees. And we believe in that framework, the idea is to engineer and educate and enforce our way to this safe environment, safe workplace. And that usually takes the form of what we call the aiming, naming, blaming, shaming, and retraining people when something has gone wrong. These 3 helmets that you see are something that I just learned about a few days ago. I attended a presentation, a workplace safety presentation, and there was a story there about at this workplace, how when you first started, you were a brand new person on the job, you were expected to wear an orange helmet. And you needed to wear that for like the first year or so that you worked, in order so that everyone around you would know that you were just beginning and learning the rules, and that they needed to watch out for you and stuff like that. At some point, you were able to graduate up to the highly coveted white helmet, which showed that you are experienced and someone to ask questions to, and someone who would look out for the people around them. But if you made a mistake and you got injured on the job, which was clearly your fault in this mindset, you were then forced to wear what they called the dunce cap, or the blue helmet, and to wear that for a certain period of time until you had a certain number of days, injury-free, so that you could go back to. It wasn't clear to me if you had to go all the way back to the orange helmet again, or if you were allowed to put your white helmet back on again or not. But this is basically an idea of all these things: naming, blaming, shaming, and retraining someone under the assumption, really, that it was their fault to begin with, and that this is the only way to get that, and get them to learn from their experience. So one more time, traditional safety, you can see the summary there on the left side, comes from the top down. Workers are a problem. Our goals really is the absence of accidents and injuries, and that we need to really track what has gone wrong in this quest for zero incidents. So I'm curious if you could once again chime in, how does this traditional safety framework possibly show up either in your current workplace or in one that you've worked at in the past? If people could share a story or two or an example, that would be wonderful. Mandating rules to follow. Underreported incidents. How do we know? John, if you could add to that, how do we know that there were underreported incidents? Lack of reporting due to the removal of earned points to receive some kind of prize. That is a really classic example. The assumption that it needs to come from the top down. That's the only way we'll get safety, is if it comes from the top down, because clearly the people at the sharp end don't know how to be safe unless we tell them, right? Focusing on a reaction of some sort to an incident versus preventing it to begin with. Great. Personal safety versus patient safety. A lot of paperwork. Telling people, Chris has a great example, telling people just be safer, try harder, care more, and that's how we'll make it safe. Great. Great examples people are sharing. Yeah, and thank you, Kayla. If you want to share your answer with all the participants, then you can click on that little blue box and change it to all panelists and attendees. And that's a nice way to share it more broadly with everyone. Great. Well, thanks so much for those great examples. And let's, excuse me. Whoops, what do I want to do here? So there's a cue for Ryan to please launch poll number 2. And I'm curious if you could, this is a multiple choice, so select any that apply. Does your program do any of the following examples? Please select all the ones that apply. Creating new policies, reporting more on what goes wrong than what goes right, finessing incident numbers for annual reports or some kind of reports, pursuing a zero incident goal, generating relatively few near misses or underreporting, as someone mentioned, maintaining a gap between what management thinks happens in the field and what actually happens, and then holding people accountable rather than fixing the issues that contributed to the incident to begin with. Looks like creating new policies as a reaction to an incident is really leading the pack here. Followed by reporting more on what goes wrong than what goes right. Finessing incident numbers is getting some traction. Generating relatively few near misses. Holding people accountable rather than organizational issues that may have contributed to the incident to begin with. Great. Yes, so it's not a surprise at all to me to see these things showing up in your workplace. And these are, again, these are very tried and true historical and traditional ways that organizations attempt, with the best of their intentions, to manage risk. And I will say that using this approach has gotten us to a certain point. It's gotten us this far. And if we want to evolve our thinking and get better, that there's more that we can do than approaching it this way. I want to especially address that first one, creating new policies as a reaction to an incident. There is always a gap between what the policies say and what people actually do in the workplace. There's always that gap. That gap already exists. And if all we do as a reaction to an incident is create some very specific policy and add on to the policies that we've already got, we're possibly just enlarging the gap between what the policies say and what people actually do. It may be something that makes the safety managers at the organization feel like they have done their job and addressed an issue, but it may not in any way actually help to prevent that kind of thing from happening again, or get to the underlying issues in the workplace that contributed to that incident to begin with. So stacking new policies on just as a reaction to an incident is a really, as we can see from our poll, a really common thing to do, but it may be an example of something that looks good rather than actually addresses the issue. So thank you for participating in that poll. Okay, so we're going to keep moving forward here, and we're going to move away from this traditional safety. Oh, here are those examples that you all just discussed. And I would say if you're doing any of these, that is indicative of the traditional safety mindset that we talked about. And it has some value, and it's gotten us to this point. But if we want to move on, there's other ways that we can look at this topic. And before we talk about safety 2 or safety differently, we are going to dive into a few minutes of a video by Sydney Dekker, who is a professor in Australia who has written an entire book called Safety Differently, on which some of this presentation is based. And let's see what Dr. Dekker has to say about this. And he's going to give some eloquent examples from, again, different industries that explore the limitations of safety 1 and how it isn't going to be how it can create complications and frustrations in the workplace.
I think there's endless benefits in giving people as much autonomy as you can possibly give them.
The price of an error in healthcare is really, really high.
You look at the experience for these guys, and they're in a middle management role on the rig, such as a driller. They're not really confident to make the decisions.
The recording, the reporting, and the trending seemed to almost take the front foot to what was actually happening.
endured broken ribs, but it definitely could have been a potential fatality. And the number one thing, and this was when I was new to the industry and I was just trying to be a team player, was to make sure that no one found out so that the rig didn't lose its safety net.
It's hard to change sometimes. And if you're familiar with a way that works and maybe it's been working relatively okay, stick with it perhaps, because I guess there's a chance that it might fail.
Imagine a space in which there's no rules, a space in which people can themselves determine the best course of action, a space in which people spontaneously negotiate and collaborate in order to create the safest outcomes for everyone. In this space, a new type of humanity emerges. Nobody is telling them. They figure it out on the spot. We call this emergent behavior. It started out with a normal traffic management system with lights and signs and barriers and lines, and all of that led to a huge gridlock every day and about 10 pretty bad accidents every year. So a traffic engineer came in and said, let's take everything out. And in this square, people now enter, and they cannot be not engaged in their own safety. And it's interesting that you make things look riskier, you actually get safer behavior. I became professor pretty early on in my life. I was 34, and so I started flying big jets on the side. And so I'm flying this jet, and of course, when you do that sort of work, you learn that compliance and procedures have a very important role to play. But when I started learning that pilots get fired because they're not holding the handrail going down the jet bridge to do the walk around on the platform of the airplane, because they're not wearing a yellow vest when they're out on the ramp, because they carry coffee on board the airplane without a lid on the cup, I'm going, what does anything of this have to do with getting my passengers alive to the next destination? So about 5 years ago, a bunch of guys from industry came together. They knew I was in the country, and they came to us and said, look, we're stuck. We're not improving, and all that we're doing is adding more bureaucracy, adding more compliance requirements, adding more paperwork, and it doesn't seem to help us any. What do we do?
Our safety performance here at Origin, with drilling completions, was definitely going the wrong way. And the frequency of which people were getting hurt on our sites was definitely increasing.
Failure and getting it wrong is not something we're well rehearsed in. And I think I fell into the trap that most executive directors do, which is we've got all the processes in place, yet we don't really see a shift in the amount of patients that suffer preventable harm in healthcare.
So Woolworths is a business that's been around for 95 years. The way that we've managed safety has been the same throughout that stint.
Safety was a pack that we received every month, and it worked its way down from store management. We had a safety team, and they would sort of communicate everything towards us.
Where many of these organizations come from is a place in which human error is a cause of all of their troubles, where people are a problem to control, where people's wide bandwidth and latitude to behave practices they see fit is problematic. That needs shrinking, that needs containing, that needs controlling.
With all the paperwork, in all reality, I was in my office probably, I would say, at least 60, 70% of my day.
You're being told all the time to do something, and you think, well, why? It's no good being told by upper management when, they've probably never had the tool in their hand.
You look at a lot of the procedures and policies that we follow. Well, we don't follow them because they don't work, is particularly in this environment. It is the most chaotic, complex environment in an emergency department.
And so we are wasting 15% of our time doing something that is of no clinical value.
Because it came from national, why should they be telling us how to do our job and how to do it safely? And they didn't know what they were talking about because they'd never worked in store.
In order to control people, you tell them what to do through procedures, through training, through surveillance, through reminders, through punitive measures.
Somebody's failed to follow procedure, we need more procedures. And we need to punish the person or counsel the person for not following the procedure.
What some of them have even done is declare a war on human error. They try to stamp out individual human errors, and they try to manage the minutiae of their workers' behaviors and their acts and into the capillaries of their daily existence to try to manage and adjust and control everything that they do.
Why? Why? Why are we doing this? It just makes them crazy. And we go crazy.
All right. Well, it's hard to read the body language in the room, you know, since I can't see any of you, but I hope you enjoyed that, and especially that humorous little part there at the end with the professor. And, you know, many of the things that some of you mentioned, stacking policies on top of other policies, punishing people who didn't comply, optics compliance, rules and regulations coming from the top down that don't seem to resonate or don't seem to connect with the people in the front lines doing the work. Many of the things that you mentioned are reflected there in that video. And if you'd like to watch the rest of it, it's on YouTube and easy to find. And I'll share the links to these things with you after the presentation. But I think that sets the stage pretty nicely for some of the limitations of the traditional safety approach. And if we want to explore a different way of looking at safety differently, as we're calling it, let's see how that would be defined. So rather than just coming from the top down, safety differently also comes from the bottom up, from the people actually with the tools in their hands doing the work, the frontline workers themselves. Rather than seeing people as a problem to be managed, safety differently sees that people can be a solution to your safety concerns. No one wakes up in the morning and wants to go to work and get injured on that day. And that people, rather than a problem to be managed, can be the ones that have the expertise and the innovation and the adaptation to be the solutions. Rather than trying to fix the worker, we should improve the work conditions, the workplace conditions in which they do their work. Safety, then, is not the absence of errors and the absence of injuries. It is, in fact, the presence of something else, which we call positive capacities and resilience. Instead of just looking at what has gone wrong, the injuries and the illnesses, we should actually be doing a better job of studying why do things go right, and that we can do more of that. We can better understand what works and to create more opportunity and to invest in helping that to occur. So let's look at a visual reference for the visual learners in the audience. This visual, I think, really beautifully captures it. On the left side, you see this little red section, which are the things that have gone wrong. And that is, in fact, a very small portion of our overall work day or our year. If the planned outcome is in the middle, and things that have gone very wrong on the left side, you know, are in that little red box, and positive surprises all the way on the right side. You know, imagine Sully Sullenberger landing that plane in the Hudson River. Very improbable, unlikely, positive surprise. In the middle is all this stuff that's just normal, everyday success, work that is actually going well. But rather than looking at that, what we do is we design our safety goals and our safety reports and all of our investments on this tiny little red portion on the left side. We're trying to avoid that rather than trying to understand what's happening in all the rest and to do more of it. So let's watch this talk here for just a few minutes.
So really in about 49, 50, 51, back then, the automotive industry said these words: asking drivers to not wreck is not very effective. It feels like the right thing to say, but it doesn't reduce the number of vehicle accidents. Our job has to change. And so what they said is, let's assume everybody driving in a car has a 100% chance that they're going to wreck. Because when you deal with uncertain outcomes, you've got to use certain terms. And so what they said is, let's not manage the absence or presence of the failure. Let's actually manage the car's ability to handle the failure. And the idea became that we can actually make cars safer and safer and safer. Now, what's interesting is if industrial safety were in charge of vehicle safety, I don't think they could make the claim of 0 fatalities. Because if industrial safety were in charge of vehicle safety, here's what it would look like in your company. We'd have a program where before you got to drive, you have to take the mandatory don't wreck the car training. It's offered at the training center every Tuesday. There's 14 slides. They all say the same thing. Good drivers wreck less, right? Right? And then once a year, you'd have to take the don't wreck refresher class, but that's on the web, so it's pretty easy to take. And then we tell everybody to drive around until someone wrecks, and then we'd stand down driving operations, and we would bring everybody into a big room, and one of you would stand up in front of them and read the procedure on not wrecking louder and slower. What part of not wrecking did you not hear the last time we did this? In fact, I'm going to suggest our target for safety has to change. I think this is our new definition. Safety is not the absence of accidents. And the reason I say that to you is if you do a high-risk operation and nothing happens, can you tell me whether you were good or you were lucky?
So that is Todd Conklin, who hosts a wonderful podcast. He puts out several per week, actually, very prolific and funny, down-to-earth kind of guy. And he puts out his podcast is called the Pre-Accident Investigation Podcast. So the idea is we don't need to wait until something has gone wrong to investigate and learn and continuously improve, but that we can create a workplace environment, as he said, that's not trying to define our safety goals as the absence of failures. It's defining it as the presence of defenses and resilience and capacity. So, and his example with the car is wonderful. Rather than trying to build the perfect car that people are going to drive perfectly, we're going to assume that that car is going to be wrecked 100% of the time. And when we do that, instead of striving for 0 incidents, what we're actually doing is adding resilience in the form of things like seatbelts and anti-rollover technology and airbags and things like that. So what are the seatbelts and the airbags and the resilience in your organization? And what is it that you have that's going to help absorb the inevitable and normal human errors and incidents that occur? And what are the things that we can put in place in our workplace that will allow humans to be humans and have mistakes without those converting into tragedies? So let's come back then with this mindset, this safety differently mindset. Let's revisit that case study that we started with, the one where in the hospitals, 1 out of 13 people were having these nosocomial complications, getting injured or getting some kind of infection as a result of the healthcare that they were receiving. This is the one where you saw that big list of workarounds and violations and policies not being followed and supervisory shortcomings and all that. And if you think back to your thinking around what was really happening there and what was going wrong, you may have thought about it from a traditional safety approach. You may have thought about things that we could do to eliminate human errors, more training, more policies. We can just find better people, right? Maybe we can tell them to just try harder, tell these people to care more about their patients and care more about their workplace. This is a sort of a very deeply ingrained traditional approach that's hard to get away from. And it's predicated on this idea that, accidents happen in our workplaces in this linear way, you know, where someone makes a mistake, breaks a policy, breaks a rule, and causes the accident. And, you know, the safety one mindset says that we just need to seek out that faulty domino and fix it and restore order within our otherwise perfect system that we've designed. Dr. Eric Holnagel, who was one of the leading authors around this resilience engineering or safety differently mindset, he asks a different question. And it comes back, his question is, what about the other 12? If 1 out of 13 is having this problem, what do we know about the other cases? So Sydney Decker, who was brought in and asked to work with this healthcare system on their issue, he asked that question. He says, tell me about the 12 out of 13. Tell me what's going right in those cases. And the hospital administrator scratched his head and it's like, well, I have no idea. I don't know anything about that. So Sydney and his team took a closer look at what was going on in the other cases. And this is the part that's really interesting. And really what they were doing was, back to this graph, instead of just looking at the little red part, they wanted to say, hey, what about all that other stuff? You know, what's going on in this big blank part of the graph that we're not studying? How can we explore that? So they went back and they looked at those other cases. And they found, incredibly, they found exactly the same list. They found that in those cases too, we had workarounds, shortcuts, violations, errors, unreliable measurements, supervisory shortcomings, all those things. Incredibly. So this is strange, right? This is hard to really fully wrap our heads around. In our first look at this issue, we thought these were the causes of the errors. We thought these were the things that were going wrong in the 1 out of 13. And in fact, these were present throughout all of the cases, but in 1 out of 13, something was going wrong, and in the other ones, it wasn't. What was the difference? What was happening that led to that? So the plot has thickened, right? And it invites this safety two or safety differently mindset, which is that we can't just look at what went wrong. We can't just focus on failures and see it as a human problem. Instead, what if we study the success and we try to make that part bigger rather than trying to make that red part of the graph smaller? So, you know, for your purposes, you know, what are the capacities that you've already got in place at your organization? Things that you're already doing that are the behaviors and the capacities that convert a tragic accident into a simple near miss instead. Or something that might even convert a near miss into a story of success, like Sully landing that plane in the Hudson River, for example. What are those things, you know, that you've already got in place at your organizations that we could do more of, rather than defining our safety goals merely as the avoidance of that one small red part? So I've been working with some outdoor programs and organizations over the last few years and helping them develop their own positive capacities in their programs, things that they want to define as the going towards something positive rather than away from something negative. Towards resilience, seatbelts, airbags, all that stuff, instead of away from human errors and accidents. So based on research that's been done, here are some examples of positive capacities that workplaces have identified as helpful for their safety goals in this safety differently mindset. And I think you'll be really uplifted by some of these because you may be already doing some of them, or they may resonate with your core values. And the first one is to allow for a diversity of opinions and a workplace culture where people have the ability to voice disagreement. A place where the boss doesn't just hear what he or she wants to hear, but a workplace where different opinions and ideas, and especially dissenting opinions, are allowed to come out so that the best decision can emerge from that. And of course, if any of you have read, someone earlier in the chat actually mentioned checklists and using them, and the importance of how that might help. Atul Gawande is a brilliant writer and a risk management thinker. And this book, The Checklist Manifesto, talks about how we can use checklists to give our brains more space so that we can have the checklist automate some things that are simpler and buy more bandwidth in our brains to be able to hear this diversity of opinions and voicing disagreements and creating a workplace where we're actually slowing down and engaging the deeper thinking parts of our brains. Another book, Daniel Kahneman, Thinking Fast and Thinking Slow, talks about this idea between that really simple, automatic kind of thinking and the benefits of this more slowed down strategic thinking that we need to make room for, and checklists can help with that. Keeping a discussion on risk alive and not just mistaking past success for future success. This is the difference between a workplace that, oh, we've never had an accident before, so we must be doing things safely, which is not necessarily true at all. The outcomes is not necessarily the same as the process that got you there. So keeping that healthy discussion on risk alive and not slipping into a complacent mindset where you're mistaking your past success for future success. Recognizing and deferring to expertise at the ground level. Expertise at the ground level. So that doesn't mean blindly following orders from above. It means recognizing that the people at the ground level who are doing the work may have the most useful information and expertise and insight. And this is some of the emergent behavior that Decker was talking about in the video as well. Creating an environment where people have the ability to just simply to say stop, time out. Let's talk through what's happening here. You know, in some workplaces, probably in every workplace, there's financial implications for saying stop. When things slow down, you know, if it's a manufacturing plant, if it's a conveyor belt, if it's a timeline, a deadline driven project with a client, whatever the environment might be, you know, for someone to have the capability to say stop is very important, but not intuitive. You know, that's not necessarily something that people gravitate to naturally on their own. So to really frame that in advance as a desired part of your workplace, and to positively reinforce that, and to let people know that it's okay to ask, to say time out, to ask questions, to, again, I also think it resonates with this first one, you know, diversity of opinions, ability to voice disagreement, keeping a discussion on risk alive, just simply being able to say time out. I'm curious, you know, if you have that in your workplace, or if you've been in a situation where you might feel like, man, I really wish I could just call time out here, but it's not my place to do that, or I might get in trouble, or that might not look good. So I think that's a really, that's indicative of a workplace culture and an environment where you're seeing people not as problems to be managed, but you're seeing people as potential, the solutions to your safety issues. It's a really interesting one for me. Also, you know, a little bit more thinking on this one as an outdoor person, mountaineer, whitewater, you know, ice climber, all the different kind of activities that I've been fortunate enough to be able to do, you know, this is, yeah, having the ability to just call time out and communicate with your team, if you're in an environment where you can, is a really important piece. And so many incidents that I can think of would have possibly gone a different way, you know, had they been able to do that. Breaking down hierarchies and silos. So there's a couple different layers to this. So the hierarchies come from a power dynamic, and you know, there's definitely a well-documented series of airline disasters and plane crashes that occurred when a hierarchy or a power dynamic was in place in the cockpit, where some of the other people, the co-pilots, saw a problem emerging and saw something happening, not necessarily quickly, maybe even just gradually, a problem arising, but not feeling like they were in a power dynamic or in a relationship with the pilot where the pilot did not want to hear that. And, in hindsight, obviously, they wish they'd spoken up or wish that, they could have communicated that differently, but it led to a whole change in some of the ways that they train pilots now with something called crew resource management, which is exactly this first item, diversity of opinions and the ability to voice disagreement, the ability to say stop, breaking down those hierarchies and silos and trying to get into a place where everyone has the responsibility to speak up in the cockpit and make sure that they're all on the same page with whatever's going on with engine number 4 or whatever altitude they're flying at as they're approaching this mountain range. That if there are unspoken or unarticulated concerns or issues or questions or concerns, that they speak up about that. Silos is an interesting one, slightly different topic, but related in terms of your organization. Where do these different silos build their own systems that may in fact compete with each other between the people doing the hiring, the people doing the training, the people writing the policies, the HR department, the actual operations on the ground. When things are built in silos, you can find them very much working at cross purposes with each other. And this is where, we might blindly be forced to follow some rule that came from a different silo or a different part of the organization that doesn't, it might help to manage liability for the organization, and it might help make the safety manager look good in their role, but it may not actually contribute to the physical or emotional safety of the participants or the staff themselves at the ground level. So again, the more you can break down hierarchies and silos and see people as a solution rather than see people as a problem that you need to manage with more rules and regulations and naming, blaming, shaming, and retraining, then I think the more this particular positive capacity comes into understanding its importance. Promoting pride in work. This is a unusual one, and it stands out a little bit in this list. But again, studies and research show this concept of something called native resilience, where the more we do good work and the more we take pride in the work that we do, and if you see your people as solutions, that promoting that pride in the work itself is a way to let better practices and adaptations and critical thinking and situational awareness to emerge naturally from the work itself. One of the videos we watched earlier, you saw the story of the pedestrian shopping district in the Netherlands, where they were having all these vehicle versus pedestrian accidents. And the more they added rules and regulations and lights and flashing lights and all these control mechanisms, the worse it got. And when they took all that stuff away and they let people more naturally go about maneuvering themselves, through that space, several things happened. It was more situational awareness on the part of the drivers and the people pushing the baby carriages and the bikes, because they weren't blindly following rules. They were more naturally engaged as human beings in moving through the world around them. And they didn't mention it specifically in the video, but the number of accidents in that pedestrian shopping district went from about 10 per year to less than 1 per year after they took out all of the lights and the crossing guards and the rules and regulations, and they let people naturally move through that landscape. And I know that people on this webinar might be thinking, oh yeah, that's great for the Netherlands, but we could never get away with that in our litigious, society here in the United States. And you'll be surprised to know that there are many cities that have actually put into place this same kind of approach to managing pedestrian car interactions. It's a whole movement through the world, this open space or shared space kind of traffic control management. And they're finding that not only does it allow traffic to flow more safely, but more efficiently. And to me, it all comes back to this promoting pride in work, like letting some natural safety emerge through human interactions rather than enforcing it from the top down. So you can find that, and I'll include some links to that as well in the resources that we send around as a follow-up to this call. And let's just see where we're at. Someone is asking if they can get a copy of this. Yes, we will share this with all of you in the video as well. So let's keep going. So you should have gotten a handout that was sent in advance of this call. And I'm going to give you a minute to work on this little quiz. So this is, again, based on research and some Sidney Dekker study that was done. There are 10 different strategies here. And I'm going to invite you to rank them from 10 being, they're all effective, but 10 would be the least effective, all the way up to 1, which would be the most effective. And if you have that handout, please use it. And if you don't, then you can just write on a separate piece of paper, and I'm going to give you a minute or so to work on this. And to reframe the question, the real question is, which strategies are most effective, and rank them in terms of creating a safer workplace in an, any kind of industrial or any kind of workplace setting. Okay, great. I hope you had a chance to come up with your rankings, and I'm going to share with you what the research showed. I want to start from the bottom, the least effective, and work our way up to the most effective. So emergency response planning, not a bad thing to do, but not the most effective on that list. Record keeping and incident analysis. Why? Mostly because it's looking backwards. It's kind of a lagging indicator as opposed to looking forwards. It's also, again, it's defining our defining our safety goals by the absence of these things rather than better understanding the presence of the other pieces. Having a written plan, safety committees. I would argue there's a wide range of things that the safety committee might focus on and how they go about their job, but likely in many cases, it's looking backwards rather than looking forwards. Having a safety manager on site, somewhere falling right in the middle here, but still in the bottom half. Frequent site inspections. Now we're starting to get the possibility of looking more into the future, anticipating issues, problem solving. Even more so, these pre-project safety briefings, really focusing the group, focusing the team, using people to identify issues, voice their concerns, starting to hear from more people. Having employee involvement in creating the actual plans and the policies and the evaluations and again, using people as resources, seeing people as solutions. This one surprised me initially how high up on the list this was. But if you think about an organization that has really carefully worked on and crafted its approach to risk management and safety, it's super important who you pick and bring into your workplace, and how do you vet and select the right match for your organization. Who are you going to work with as your subcontractors and stuff like that. So while I was initially surprised at how high this was on the list, I believe it would be quite important for those reasons. And finally, upper management support. And this is not the same as saying that safety comes from the top down, but if you don't have upper management that cares about, is focused on, and is supportive of your risk management efforts, then you're going to be probably in a situation where you're struggling to go cheaper and faster, which is not always safer. So having upper management support and upper management that puts the right time and resources towards your risk management goals is really going to make a difference. So that's why I have this $ and this clock off to the right of this screen. It's the question for you is, which of these strategies, would you say your organization is investing time and money in? And while we can spend a lot of money at the bottom end of this list, I think it's also really important to focus culturally on the top end of this list, some of which doesn't cost anything. Having employee involvement in safety and evaluations and safety briefings, and other than the time that takes, those are not expensive choices. So anyway, I hope there's something useful for you that comes out of this interesting ranking and somewhat surprising couple of answers. So I'd like to move on into applying some of these concepts that we've talked about. And before we do that, just a quick verbal recap for you. The movie that we watched, and maybe some of the examples that we've given, has posed this presentation a little bit like Safety 1 versus Safety 2, like those things are really in conflict with each other. And I want to say that they're both important. We couldn't have Safety 2 without Safety 1. And Safety 1 has gotten us so far. This traditional approach to safety has really taken us so far. And the point is not either or, it's a question for you of both and. Many of you work in environments or kinds of sectors that do have a lot of externally imposed rules and regulations and elements of traditional safety that are very embedded in how you operate and how you succeed, as a company. And that's not a bad thing. But if we want to evolve and not just define safety as the absence of injuries, but we want to define it as the presence of some of those other things and evolve and adapt and get better, then that's where the Safety 2 concepts come in. And I personally think it's really applicable in many ways to adaptive sports, because we're not talking about what people can't do. We are talking about what can they do. And we're not defining, it's not a deficit-based philosophy, it's an asset-based philosophy. It's looking at how can we define our safety goals by the presence of positive things and not just the absence of negative things. So I think it's a really uplifting and positive approach to safety for any industry, but I think especially in the adaptive sports setting for those reasons. It's my opinion. I'm not an expert in adaptive sports, and I'd love the insights from those of you on this webinar who are. But let's apply some of these concepts to your program. I want to invite you to, whether you're sitting there with a colleague or on your own, to take 60 seconds and just jot down a whole bunch of your ideas and then to share one or two of them in the chat box. And let's just fill the chat box with a bunch of ideas. How can you apply safety differently in any way to your organization or your workplace? A couple of the great ideas we've seen so far. Beth says we can invite program participants to be involved in some manner, commenting on safety concerns, solutions. Kirsten says, approaching safety like we do with our participants from a strengths-based growth mindset. Thank you, that's nicely said. John adds that we can have positive after-action reports when safety procedures are reported. That's great. Learning from the things that went right and celebrating and reinforcing something that went well. Michael agrees, involving participants prior to events and programs. Patricia adds that we can use a portion of morning meetings to review a verbal checklist of safety high points for that day's lessons. That's great. Some common, normal, repeating routine or ritual like that, you know, where you're reinforcing those things on a regular basis and keeping that discussion on safety alive, not being complacent. Learn to fail safely and learn from each incident. That's great. Engaging upper management in safety design from Elizabeth. These are excellent ideas, folks. I'm going to leave this open for just a little longer. Let anyone else who would like to add in do so. If you see something, say something, Catherine adds. Don't wait for a problem to happen. That's great. And that's a good example of the positive capacity around not letting hierarchies get in the way and speaking up when you have issues. And yeah, I think that's a great approach. All right, well, let's move forward. Thank you all for those great ideas and those ways to apply safety differently to your workplace. Last one, Chris adds, talk to your employees and ask them what they do and what would work better. That's a really important one, actually. If I could say that one in my own words, it's the difference between telling people what they need to do to be safe and asking them what they need to be safe. So you get very different answers if you approach it that way. And I think that's a really good insight from Chris, so thanks. So I'm gonna move ahead here and let me provide a little bit of a wrap up, and then I'd love to take any questions people may have. So in wrapping up, you know, some action steps that I would suggest that would be helpful for you is to evaluate your organization's plans through this safety differently lens. Identify some more of those positive capacities like the ones that we just came up with in the chat box. Identify which ones would apply best to your program. Ask the frontline staff, the workers at the ground level, ask them what they need rather than telling them what they need to do. And then bring that information back to the leadership team to involve them. And contact me if you have any questions about this presentation, if you have concerns, if you want support for implementing any of these tactics at your organization. I'd be very happy to either directly help you myself or point you towards resources that might be useful ones for you. So with that, I think what I'd like to do is just see if there are any questions or concerns in the Q&A that we can address. You know, I'm sure that some of the stuff that we've talked about here today might sound good in theory, but you have struggle to imagine how would this actually work in my workplace, or you know, how might we get support from upper management if we actually wanted to do this, etc. So I'm sure there's really valid questions that people may have, and I'd be happy to do my very best to try to answer those. And here's some recommended resources as well that you might want to take a look at. So Ryan, if you have any questions in the Q&A that you think would be useful ones to tackle, or if you would like to add any thoughts of your own from your perspective, Ryan, please feel free.
Yeah, absolutely. Thank you again, Steve. That was extremely helpful, and I'm sure a lot of light bulbs went off in people's heads, or those glass panes were shattering, changing their views on how to view safety and risk management as a whole. And that was super helpful. And as Steve mentioned, please feel free to throw your questions in the Q&A section here, or even if you've got a couple scenarios you want to try to bounce off real quick here. We do have a couple minutes, so feel free to ask those questions away. One that we've had come up was actually, do you have experience, or do you know of other organizations who have had experience trying to balance this new way of approaching safety versus competing with kind of directives from their insurance companies or their insurance providers that are still in the safety one mindset?
Yeah, well, that's a really good question. And I have two thoughts on that. The insurance providers don't want to pay out on fatalities either. And it behooves them to help the organizations not just look good, but actually be good. Because in the end, you don't get sued for an accident that doesn't happen, and you don't have to pay out claims on, incidents that are prevented. And so there are definitely insurance providers that understand all that and approach it that way and would be uplifted by this approach. There's others that might be very rooted in a reactionary, rule-driven, traditional approach to safety that sees workers as problems. And if so, that may not be the right insurance company for you to work with. So that's my thought on that. And that, everything I've presented here today is actually very solidly backed up with research and a lot of momentum that's being generated around safety differently. And so, the key would be to make sure that you find the right insurance provider that aligns with your organizational philosophy and your values, in the same way that you want to look for an attorney that does the same, or a physician advisor if you work with one of those in your programs, or whatever it might be. So, this is about being good and not just looking good.
Great, absolutely. And then similarly, how does that, do you have kind of any guidance or recommendations if it's not the insurer, but let's say a national governing body or industry leader is setting standards that are, again, in that safety one mindset?
Yeah.
How to approach that?
Yeah, I don't think that we're ever going to completely get away from safety one. We live in a society that has rules and regulations, and that's not a bad thing. I also think that this is about adding in safety two, not taking away safety one necessarily. I think we're always going to have some element of foundation of safety one on which we sit. And this is about looking at a place that's really been more of a blind spot and trying to do, rather than trying to make the little red part of the graph smaller, we're trying to make the other part bigger by adding in capacity, adding in resilience, defining our safety goals as the presence of that stuff, not the absence of the other stuff. So, it's not either or, safety one or safety two, it's both and. How can we get to a place where we're effectively doing both? And that might look very different in different industries or different workplaces. It might look very different in a nonprofit outdoor program than it would in a big government run facility or healthcare setting or something. So, the key is to take what parts of this talk today resonate with you and your organization, and to try to cultivate those and build on those.
Great. All right. So we are coming up on time here. So if anyone has a last minute question they want to ask, feel free to throw it in the Q&A section. Steve, again, I want to thank you for taking the time, rescheduling here last minute to kind of follow up on our virtual leadership conference from last month and taking some time here this afternoon. Thank you again, everyone, for joining us. As a reminder, all this information will be posted on the website As Kayla just put in the chat, it'll be there on moveunitedsport.org/2020 Virtual Leadership Conference. Gives about 24 hours. We'll also be uploading the video to YouTube, as well as you'll be able to find the additional resources Steve's pointed out and the slides. So thank you again, everyone, for joining us, and enjoy the rest of your Monday.
And thank you all so much for having me. Thanks to Move United for inviting me to do this talk. I hope you all enjoyed it. I'd be happy to follow up with anyone who has any follow-up questions for me. Have a great rest of your day. Thanks very much.
Thanks, Steve.